Prediabetes is not a life sentence, but most people hear that word and immediately think one thing: diabetes is coming. They go home scared. They stop eating sweets for a few days. They promise themselves they'll be careful. Then life gets busy. Nothing hurts, no symptoms appear, and slowly they forget. Until one day, the blood test changes. A 1C goes from 6.1 to 6.7. Fasting sugar crosses the line, and suddenly the word is no longer prediabetes, it is diabetes. But here is what many people are never told clearly. Prediabetes can often be reversed, not managed forever, not simply watched, not ignored until medication becomes necessary. Reversed. I'm Dr. Emily William, and today I'm going to explain what prediabetes really means, what is happening inside your body, why it is dangerous if ignored, and the exact daily steps that can move your blood sugar back in the right direction. Stay with me until the end, because the final step is the one that helps you know whether your body is actually healing, and most people never track it correctly. Before we begin, this video is for education only. If you have diabetes, prediabetes, take medication, or have kidney, heart, or liver disease, please follow your doctor's advice. Now let's begin. Number 1. Prediabetes is a warning, not a final diagnosis. Prediabetes means your blood sugar is higher than normal, but not high enough to be called type 2 diabetes. Usually, doctors look at numbers like fasting blood sugar between 100 and 125 milligrams per deciliter, a 1C between 5.7% and 6.4%. A 1C is like a 3-month report card for your blood sugar. But here's the part most people miss. Prediabetes is not just a little sugar problem. It is often a sign of insulin resistance. Think of insulin like a key. After you eat, sugar enters your blood. Insulin helps unlock your cells so that sugar can leave the bloodstream and enter the cells for energy. But when the body becomes insulin resistant, the locks stop responding well. The pancreas makes more insulin, the body pushes harder, blood sugar stays higher, and over time, the system becomes exhausted. Prediabetes is your body saying, "I am still fighting, but I need help now." That is why this stage matters so much, because this is the window where many people can still turn the story around. Number 2. Why prediabetes is dangerous even before diabetes. Many people say, it's only prediabetes. But pre does not mean harmless. High blood sugar can slowly damage blood vessels, nerves, kidneys, eyes, and the heart. Think of excess glucose like sticky sandpaper moving through the bloodstream. At normal levels, glucose is fuel. But when it stays high too often, it begins irritating and damaging the delicate lining of blood vessels. Over time, this can increase the risk of type 2 diabetes, heart disease, stroke, kidney problems, vision problems, nerve damage, fatty liver, brain fog, and fatigue. And the dangerous part is that many people feel completely normal. No pain, no warning alarm, no dramatic symptom. That is why blood tests matter. Prediabetes is often silent, but silence does not mean safety. Number 3. The most powerful reversal tool is food. The first major lever is food. And no, this does not mean you must starve yourself. It means you must stop flooding your bloodstream with fast sugar and refined carbohydrates all day long. The biggest blood sugar triggers are often sugary drinks, sweet tea, soda, fruit juice, white bread, white rice in large portions, pastries, cookies, candy, sugary cereals, processed snacks. These foods digest quickly and can raise blood sugar fast. Now compare that with foods that slow sugar down: vegetables, beans, lentils, eggs, fish, chicken, Greek yogurt, nuts in small portions, seeds, oats, whole fruits instead of juice. The goal is to build meals around protein, fiber, and healthy fats. Here is a simple plate. Half plate, non-starchy vegetables. 1/4, protein. 1/4, high-fiber carbs. Add a small amount of healthy fat. This kind of meal slows digestion and reduces blood sugar spikes. And here is one powerful trick. Eat vegetables first, then protein, then carbohydrates last. Same meal, better blood sugar response. Number 4. Losing even a small amount of weight can change everything. Many people think they need dramatic weight loss to reverse prediabetes, but research shows that even losing 5% to 7% of body weight can significantly lower the risk of type 2 diabetes. For many people, that may be 10 to 15 pounds. The most important fat is not always the fat you see under the skin. It is often visceral fat, the fat around the organs, especially around the belly. Visceral fat is metabolically active. It worsens insulin resistance and keeps the body in an inflammatory state. So when waist size comes down, blood sugar often improves. This is not about shame. This is not about appearance. This is about biology. Every pound of harmful fat lost can make insulin work better. Number 5. Walking after meals is a blood sugar weapon. Movement is one of the fastest ways to improve blood sugar. When you walk, your muscles pull glucose out of the blood and use it for energy. The beautiful part is this: muscles can absorb glucose during activity with less need for insulin. That means movement creates another doorway for sugar to leave the bloodstream. One of the best habits is simple: walk for 10 to 15 minutes after meals, especially after your largest meal. You do not need a gym. You do not need intense workouts. You do not need to run. Just walk. If walking is difficult, do seated leg movements, gentle marching in place, or light activity approved by your doctor. The goal is consistency. A 10-minute walk after dinner, repeated daily, can be more powerful than one hard workout once a week. Number 6. Build muscle to store sugar better. Muscle is like a storage tank for glucose. The more healthy muscle you have, the better your body can handle blood sugar. This is why resistance training matters. Resistance training can include light dumbbells, resistance bands, wall push-ups, chair squats, step-ups, carrying groceries, bodyweight exercises. You do not need to become a bodybuilder. You simply need to tell your muscles, "We still need you." 2 to 3 sessions per week can make a real difference. Walking burns sugar today. Muscle helps manage sugar tomorrow. Both matter. Number 7. Sleep and stress can raise blood sugar. Many people fix food but ignore sleep. That is a mistake. Poor sleep can worsen insulin resistance. Stress can raise cortisol. Cortisol can push blood sugar higher, even when you are not eating sugar. This is why some people wake up with high fasting sugar and feel confused. They say, "I didn't eat anything." But the body can release glucose during stress, poor sleep, or hormonal changes. So blood sugar control is not only about food. It is also about sleeping 7 or more hours when possible, keeping a regular sleep schedule, reducing late-night screen time, managing stress, breathing slowly, walking outdoors, avoiding heavy late-night meals. Your nervous system and blood sugar are connected. A calmer body often handles glucose better. Number 8. Know your numbers and retest. This is the step many people skip. Do not guess. Know your numbers. Ask your doctor about A1C, fasting glucose, fasting insulin if appropriate, cholesterol, triglycerides, blood pressure, waist size, weight trend. Then make serious changes for 90 days. Why 90 days? Because A1C reflects roughly 3 months of blood sugar patterns. After 90 days, retest. That is how you know whether your body is moving toward healing. If your A1C drops from 6.2 to 5.8, that matters. If fasting glucose improves, that matters. If waist size decreases, that matters. If energy improves, that matters. Track the proof. Motivation becomes stronger when you can see progress. Number 9. Medication can help, but lifestyle is the foundation. Some people may need medication like metformin. Metformin can be useful. It is not the enemy. But medication should not become an excuse to ignore the cause. A pill may lower numbers, but lifestyle improves the system underneath. Insulin sensitivity, weight, muscle, inflammation, blood pressure, heart risk, energy. In the diabetes prevention program, lifestyle changes reduced diabetes risk more than metformin overall, and the effect was especially strong in older adults. That does not mean medication is bad. It means lifestyle is powerful. Use your doctor's guidance, but do not underestimate what daily habits can do. Number 10. The simple 90-day pre-diabetes reversal plan. Here is the plan. For the next 90 days, remove sugary drinks. Eat protein with every meal. Fill half your plate with non-starchy vegetables. Choose whole fruit instead of juice. Reduce refined carbs. Walk 10 to 15 minutes after meals. Do resistance exercise 2 to 3 times per week. Sleep on a regular schedule. Manage stress daily. Track A1C and fasting glucose with your doctor. This is not magic, it is biology. Give your body the right conditions, and many times it begins moving back toward normal. Final message. Prediabetes is not a waiting room for diabetes, it is a warning light. And warning lights are not there to shame you. They are there to protect you. If you act now, you may be able to reverse the direction. Your blood sugar can improve. Your insulin resistance can improve. Your energy can improve. Your weight can improve. Your future risk can improve. But the window matters. The earlier you act, the better your chances. So if your doctor told you that you are pre-diabetic, do not panic, but do not ignore it. Start today. Change breakfast. Take the walk. Build the muscle. Sleep better. Retest in 90 days. If this video helped you, comment below. What is your biggest challenge? Sugar, bread, rice, late-night eating, or lack of exercise? And share this video with someone who has been told they are pre-diabetic. They may not know this can be reversed.